Effect of heparin prevention in patient diabetes. Definition. Use appears in Ecuador in conclusion. Definition. Diabetes mellitus is associated with a rise in the class in the German conclusive vascular event, would increase the risk of hemorrhagic balances of benefit and danger, the prevention of the cardiovascular event patient with diabetes. Effect of aspirin. Effect of aspirin, the house aspirin primary prevention is based after cerebral vascular accident, transient cerebral ischemia, or acute myocardial infarction. Absolute benefits are leadership of the breed derived of a marker. Example 1, example 2. Aspirin for primary prevention in
People with
diabetes.
pre-existing cardiovascular disease, aspirin use is associated with overall benefit. Patients with diabetes mellitus are at increased risk of cardiovascular events, but the benefits and risks of aspirin as primary prevention in patients with diabetes are unclear. In this multi-center randomized double-blind placebo-controlled trial, 15,480 adults with diabetes but no evidence of cardiovascular disease were randomized to receive 100 milligrams of aspirin or placebo daily. The primary efficacy outcome was the first serious vascular event, defined as a composite of non-fatal myocardial infarction, non-fatal stroke or TIA, and vascular death. The primary safety outcome was the first occurrence of any major bleeding. After a mean follow-up of 7.4 years, the primary efficacy outcome had occurred in significantly fewer patients in the aspirin group than in the placebo group. However, aspirin use was associated with significantly higher rates of major bleeding. The majority of bleeds were gastrointestinal and extracranial. The numbers of fatal bleeds and hemorrhagic strokes were similar between groups. The authors conclude that as primary prevention in people with diabetes, low-dose aspirin reduced the risk of serious vascular events, but it also increased the risk of bleeding. Full trial results are available at nejm.org.
One of the biggest problems for people with diabetes is trouble with their heart and blood vessels. Normally, your heart pumps blood to large blood vessels called arteries. In the heart, these are called coronary arteries. The blood, which is carrying oxygen, travels through the arteries until they turn into small blood vessels called capillaries. In the capillaries, the oxygen leaves the blood and enters your cells. Other blood vessels, called veins, then carry blood back to the heart. But over time, diabetes can damage the inside of blood vessels, including the arteries that supply blood and oxygen to the brain and heart. This damage allows a waxy, fatty substance called plaque to build up. Over time, this plaque can narrow or even block the arteries. When an artery in the heart or brain becomes narrowed or blocked with plaque, it's harder for enough blood and oxygen to get to the cells. In the heart, this can lead to a heart attack. In the brain, a stroke. In fact, people with diabetes are 2 to 4 times more likely to have a stroke or heart attack as someone who does not have diabetes. Many people with diabetes also have both high blood pressure and high cholesterol levels. This puts them at even a greater risk for heart attack or stroke. Although diabetes can hurt your heart and blood vessels, there are many ways to keep them healthy and in good shape.
Hospitals in Ecuador. In Ecuador is affecting the population with another rate according to the houses super prevalence diabetes population 10 or 59 years on 10% that population adults from the 10 years high affecting on the equation. Really, high diabetes, underlying physical in alcohol, abuse, cigarette smoking are the risk factors directly related to the community diabetes, include diabetes. Effects, conclusion. The huge aspirin prevents serious vascular events in people with high diabetes and even cardiovascular, or eating the student boost has more building event, absolute beneficial, the less of the feet, the free hemorrhage than you. Thank you.